If you peeled off all your skin, your body would lose moisture almost immediately, causing severe dehydration. Next, you'd have no barrier to stop bacteria.
So you'd have massive fluid loss. I mean, this is what happens in burn patients when they lose a significant portion of their skin. Also, the greater amount of skin you lost, the less chance of survival. A 100% burn patient is like 100% death.
So infections would spread quickly through your body. And you'd also lose heat quickly, leading to hypothermia. Finally, exposed blood vessels would leak fluid, leading to shock, a drop in blood pressure.
Yeah, organ failure, including the kidneys, heart and lung, all this would unravel and fail.
That stops organs from working. And within hours, it would be impossible to survive.
You'll also be in severe pain if all your skin peeled off as well. Burn patients are in an extraordinary amount of pain.
If you swapped brains with your mom, would you be you inside your mom's body?
First of all, obviously this is not possible. Once you sever the spinal cord, you can't put it back together. Then there's immune rejection, and there's all sorts of ethical issues associated with this. I don't think you would be you or your mom would be you, but it's kind of an interesting topic for debate.
An African soldier would place an army ant on his wound, allowing it to bite down and clamp the edges together. Then, he would twist off the ant's body, leaving the head and mandibles in place as stitches.
So you'd have to find large enough army ants with strong mandibles to do this. This is an actual way some people would do this, armies would do this, in remote areas like jungles.
He would repeat this process until enough ants were used to secure the wound and wait for it to heal.
So, like I said, this would replace stitches or staples, and the head would naturally fall off in a couple days. This works because these ants have very powerful mandibles, which can tightly clamp and don't let go. And once again, it's mainly done in remote jungle or combat settings where medical help is unavailable.
If your nose gets sliced off, doctors can place tissue expanders under the skin of your forehead. Once it is stretched out enough, they'll shape it into a nose. Then they take some cartilage from your rib cage and craft it into an internal structure.
So this is interesting. I've not really heard of using a tissue expander to expand it. What they do is they can rebuild cartilage. They can take it from your ear, they can take it from your rib to rebuild the cartilage, and then they would usually use a forehead flap to cover it up, and they might use some internal flaps to create the lining. But that's the most common way I've heard this done.
The parachute released, but for some reason it didn't open, and she fell over 3,000 feet with the tangled parachute trailing behind her, blacking out on the way down. She crash-landed, breaking bones, including her spine and even her tooth.
Probably good she blacked out, because that would have really hurt. She must have been in a lot of pain when she woke up. I can't believe she survived that. The parachute must have opened enough to cause some resistance so it wasn't a complete free fall. This is a bizarre story, and she's really lucky to be alive.
She was rushed to the hospital where doctors tried to stop the internal bleeding, but miraculously she survived, and 5 weeks later she was walking again.
Wow, that's crazy. I bet though she has some type of ambulatory problems that's going to plague her whole life. She's just lucky to be alive.
During surgery, they removed the wrong foot. This happened because the man's paperwork mistakenly listed his left foot as infected when it was really his right. And when he went in for surgery, the healthy foot was marked. He woke up and realized that he had lost the wrong foot, meaning he had to go through surgery again to remove the right one.
This is something that you hear about, rarely ever happening, but wrong foot amputation, wrong side of the brain being operated on. You always go through multiple checks with this. You always ask the patient as well, mark the area, multiple people see it, and it's real unfortunate that this still happens.
Did you know doctors can inject medicine directly into your brain? They do it with the help of an Omaya Reservoir. It's a dome-shaped device connected to a tube called a catheter. To place it, the surgeon makes an incision in your scalp and creates a pocket between your scalp and skull. Then, they make a small opening in your skull for the catheter, which goes down into a fluid-filled space in your brain. Once it's in place, medicine injected into the reservoir will reach your brain.
The Omaya Reservoir is obviously used by neurosurgeons. It's done for people who have the chemotherapy for brain cancer or severe infections in the brain, like fungal infections or severe antibiotic bacterial infections, meningitis in extreme cases. And it can also sometimes help monitor the pressure in the brain. Usually other devices are better for that.
A doctor drilled a needle into a woman's arm to save her life. But when they tried to pull it out, it wouldn't move. An x-ray showed the needle had bent deep inside her bone, like a twisted paperclip. The woman was dangerously dehydrated and needed the needle to pump fluids into her body. But now surgeons had to carefully pull the bent needle out piece by piece without breaking it further.
This is something that's rarely ever done in adult. I've actually never heard of it done in adult. It is done in pediatric patients where basically they need large IV access and they can't get any IVs in because children's veins and arteries are much smaller. So they do what's called an interosseous IV where they do that, but it's usually below the knee and the leg. And then once that's successful, you can pump large volumes of fluid in and save the child's life.
He felt everything as the scalpel sliced into his abdomen, but he couldn't move or cry out. That's because he was given drugs to paralyze him, but they forgot to give him the drugs to knock him out. For 16 minutes, he was wide awake in extreme pain until the doctors finally put him under.
Usually on a person who's not on a lot of medications, the anesthesiologist would notice the heart rate and blood pressure go sky high and know that the patient's feeling pain. So they should be monitoring that constantly. So it shouldn't take 16 minutes though for them to figure that out.
After the surgery, he couldn't sleep and became paranoid from the trauma. And tragically, he took his own life just 2 weeks later.
So that's really tragic, horrible, horrible. You know, the key is to make sure you're with a good anesthesiologist who can monitor you and take care of you during your operation.
Brain surgery is sometimes performed while the patient is awake, and this is done to help surgeons avoid damaging critical brain areas. You see, they'll ask the patient to perform tasks like speaking or moving their arms.
I've even heard of one particular patient was playing his guitar while they're doing brain surgery. It's really amazing.
And by directly observing their responses, surgeons can precisely navigate around crucial brain regions, ensuring essential functions remain intact.
Now that way they can observe essential functions remain intact, but also they can see if they go to certain areas of the brain, if it causes any problems. So that saves a lot of gray matter and obviously complications risks. So it's an amazing thing.
A doctor would drill a hole in your head if you had a really bad headache 500 years ago. They would begin by shaving the area, then use a hand-operated tool to start drilling into your skull.
This is actually true. This really happened. It was called Trepation. It just never really worked.
Some of these doctors believed this would allow evil spirits to escape through the hole. In reality, the procedure had a very low success rate and probably just caused more pain.
Thankfully, with the advent of modern medicine, that's not performed anymore.